Hi and welcome to today's Oxford Centre for Personalised Medicine flash interview vlog, where we talk to different people involved in the field of personalised medicine about their life, their work and their experiences. Today we're joined by Dr. Ali Kay, a genetic counsellor from the University of Oxford and also a rare disease parent. Hi Ali, thanks so much for taking the time to talk to us today. Could you start off by telling us about yourself, so who you are and your background?
Hi Katherine, thank you for inviting me. Yes, I'm a research genetic counsellor here at the University of Oxford. I am also a rare disease parent, and so I bring some background in patient advocacy as well. So I suppose I do wear two hats on occasion. My background, I suppose people usually tell me it's quite interesting, and I think it's quite useful that, if you like, all my roads have come together. But I actually started out in social sciences. That was my original training. And I've always been really interested in decision making and why people make the decisions that they do. It's interesting that that has now led me into genetic counselling and health decisions around risk that people now make.
Perfect. So if I say personalised medicine, what does that phrase mean to you, both as a genetic counsellor and also as the mother of a child with a rare disease?
You know, that's such an interesting question, because I think in many ways it's not really defined very well at the moment. I think it means different things to different people. And in some ways, I think that's useful, because I think it is a very interdisciplinary field. And so it's nice to be able to draw lots of people in to the conversation. On the other hand, I think it's tricky when a term is not clearly defined, because that means it can be easily misunderstood. For me, it's more than precision medicine, which is often a term that's used interchangeably, because I think it's much broader. I think people in healthcare have always tried to tailor their conversations and the interventions and the medicines to the personal needs of the patient. I think that sense of personalised medicine has always been there. But I think what we're able to look at doing now with breakthroughs in technology and making technology more affordable is to try to use that sort of still quite big data approach, really, to finesse and refine what we're actually doing with subsets of patients. Where I think there's maybe an area of misunderstanding is, I think, for the general public, I think personalised medicine might be interpreted to be very individualistic. And so if there's a perception that one person is getting a very individualised treatment, but in their area that's not happening, I think that could lead to a feeling of lacking equity or not being listened to for some reason. So I think it's a really interesting question as to what personalised medicine is and what do people understand it to be.
And do you think having such a personal connection in terms of having a child with a rare disease has affected the way that you think about things like precision and personalised medicine?
I think that's interesting, because I think with my genetic counsellor hat on, I think we try not to be thinking of ourselves. We're always thinking of the person in front of us and what a piece of information means to them. And so I'm very conscious of not bringing, in a sense, too much of my personal experience into any individual conversations. On the other hand, I think what my personal experience did for me was, well, firstly, it opened the door to a fascination with genetics and our health, but it also opened the door to a whole new community of people engaged in patient advocacy, and what the sort of emotional motivation was behind being engaged in that advocacy. So what I can see is a community of extremely motivated, extremely well-informed potential public contributors to, you know, lots of really vital research projects. And I can see that that's actually a really, really vital part of where we continue to go, because I know that that's happening in pockets really, really well, but I think we can have even more public and patient involvement in work as we go forward. And I think that's going to be really important for making sure that we're really addressing the right outcomes that will really make a difference to the quality of people's life.
So you've been working on a project at the University of Oxford in a group of Professor Anne Gorelli termed the PREGCARE project. Do you want to tell us more about this project and what your involvement's been?
Yeah, so I think often when people think about personalised medicine, the first thing that jumps into their mind is, you know, novel therapies and, you know, drug medicine interventions. But actually, there's a whole area of personalised medicine around risk assessments that can make a really significant difference to informed decision making. This might help us with, you know, efficiently allocating pathways. It could help patients with navigating the anxiety around their health decision making much better. So PREGCARE fits into that space, and it stands for Precision Genetic Counselling in Reproduction. And the original PREGCARE project, which began in 2018, recruited 60 families who had had a pregnancy or a child affected by a serious genetic condition that had been caused by a de novo mutation change. So when a family has gone through an experience like that, it's an important question as to whether this can happen to them again. Now, at the moment in routine clinical care, we use population figures, we use an empiric risk figure to try and support them and inform their decision making as to whether to continue having a family and what they might want to access to help them manage that process, be it invasive testing, you know, or possibly non-invasive testing. I think this is quite this is a really useful area of personalised medicine, because although there are obviously short-term costs in putting into place a new test, the long-term impact of being able to make more informed decisions around reproduction could have significant health economic benefits. So there's a big picture view that we need to take when we look at risk assessments. I think with PreGCARE, it's just such an interesting conversation to be having, both with clinical geneticists, genetic counsellors, and also families, as to how this could change what they're experiencing when they try to make informed decisions together.
And so what has your role really been as a genetic counsellor in this project? Where have you slotted in?
So I have a really nice role within this, which is gathering the qualitative evidence that we need to then take forward all that fantastic scientific research that's happened. So there are two elements to that. So the first is to look at the experience of healthcare practitioners. So that's the ePregCare project, and I'm currently finishing interviews for that with clinical geneticists and genetic counsellors. This is really interesting because we've interviewed people who both have and have not experienced providing personalised risk assessments to families. And another project that we're developing at the moment, and we're including lots of public involvement in the development of that project, which is fantastic, is to look at the impact of PreGCARE as a strategy for identifying those high risk or low risk couples. And that's also going to be a qualitative interview study. And we'll look at how people experience risk, because risk perception is subjective. So what is it that's influencing their decision making? And could having personalised assessments make a difference to them? Because of course we've got families who are deciding not to have another child because even though in routine clinical care, that empiric risk figure we give them is generally perceived to be low, around 1%, if you've already had a child affected by a serious condition, 1% doesn't necessarily feel low. It actually is an area that feels hugely uncertain and a risk that many people feel that they can't take. Pregnancy can be quite an anxious journey for lots of people anyway, but if you've already experienced your child being ill and a diagnostic odyssey perhaps, and some of that can be really quite traumatic for some families. But that doesn't mean that they don't want to have more children. And at the moment, they're trying to make decisions based on information that perhaps some of them are not finding reassuring. And when people aren't reassured, they reach out for other sources of information. So they may want to have invasive testing, for example. And although we now know that the risks for invasive testing are lower than what we once thought, that risk of miscarriage from an invasive test, it does still carry risks, and people may be having unnecessary procedures. So I think having personalised risk assessments can really help us to manage that process for people. I think there are challenges. There are challenges at a cost level. You know, how do we bring this in? Labs are already very stretched and very busy. You know, how do we bring this in a way that is manageable in today? But I think we do need to take a broader long-term perspective when we're talking about costs for the potential savings in the future. I think more broadly in personalised medicine, if we just take a more helicopter view, sort of not just the PreCare project view, there are lots of issues around how we're going to store all this data and whether people are really truly informed when they give their consent as to what might happen to their data in the future. Also, can we future-proof the way that we're collecting that data so that it will be useful in the future? Patient registries are a really important source of information. Can we make sure that they're all standardised and following the same procedures for collecting and storing information so that it will really be useful in the future?
Lovely. So finally then, where would you like to see the field of personalised medicine heading in the next decade or so, both with your professional hat on, but also on the more personal side? What is it that you think would make the biggest difference to our lives?
I think that's tricky because there are so many elements that you could choose to focus on. I think for me, and I think this probably does actually bring together both my personal and professional experience, it is that this should be a conversation that we have together, that it's not just pockets of researchers, because there are considerable ethical implications to all the steps that we now take. And I think involving public and patients on that journey. And also, I think being open about the timescales for all of this and how long it's going to take. Because if you do have families or individuals with conditions that they're desperately seeking an effective treatment for that doesn't currently exist, you know, they want that quickly. And the reality in many cases will be it's going to take us a while to achieve that. I think lots of people, lots of patients and members of the public are very keen to see personalised medicine advance. They can see logically that that would work better for them. It sounds better to have a personalised approach. But we need to be aware that the timescales on this mean that for some people, the benefits will not arrive in time for them. And to be very clear and open about that so that we're not misleading anybody.
Perfect. Thank you so much for your time today. Have you got any final comments that you want to make?
I think really that I just want to encourage younger researchers to come into this conversation about personalised medicine, because I think it's a field in which we need to keep those conversations going, and a fresh set of eyes is very, very welcome in that. I think we're going to be exploring the ethical and societal issues around this for quite some time. And we're not yet, I think, fully aware of how different groups in the public are going to be impacted. And so we need to make sure that people are coming into the field and seeing it as a, you know, a great place to be engaging all their fantastic research skills.
Brilliant. It's been an absolute pleasure talking to you. Thank you.
Thanks, Katherine.